Order. Jim Shannon to move the motion. Jim Shannon.
This House has considered respiratory health. Mr Chairman, first of all, can I say what a pleasure it is to serve under your chairship, and I look very much forward to others making a contribution in this debate. I realise the importance of it, and first of all, the first thing to do is to thank the Backbench Committee for accepting this debate. I was at the Backbench Committee not Tuesday past, but Tuesday week ago, and had 3 requests in. Probably fairly well looked after. I got this first one today. I have another one coming on the 28th of November in the main chamber, and I'm waiting shortly to hear when the third one will take place. So and then we'll get more, and we'll keep at it. But today's debate is very clearly on respiratory health. Declaring interest as the chair of the APPG for respiratory health and the importance of that. Whenever, over the years as APPG, Mr Chairman, ladies and gentlemen, honourable members, right honourable members, I've been aware of the issue of respiratory health. It's been something that's affected my family. I suppose that's where we start. And when you have it as a family, and a family, one of my sons, I became very aware of respiratory health and how it affected him. Did I understand it all? Probably not, but I understood it better after having my interaction with my son, who's now a 34-year-old man, married and 2 children, but still has some issues with his respiratory health. But anyway, I'm delighted to be able to raise the issue of respiratory health, and I look forward to all the contributions today, and in particular the response from the Minister. It's always a pleasure to see the Minister in her place. It makes my day and makes everybody else's day, I'm sure, as well. And I know that the Honourable Lady has a deep interest in this subject matter. So I'm pretty sure that we'll be encouraged by what the Minister will tell us today as well. I'm very pleased to see the Shadow Minister in this place as well. And he and I have discussed this already this week on a couple of occasions. And we've had an opportunity to perhaps focus on what we would love to see coming out of this debate today. Because this debate isn't about us as members. This debate will always be about our constituents. It will always be about those who contact us. It will be on behalf of all the people within this great nation of the United Kingdom of Great Britain and Northern Ireland. As chair of the APPG for respiratory health, I'm going to cover a number of issues today around asthma, around severe asthma, around COPD and silicosis. We've been doing a bit of an inquiry through the APPG and silicosis in particular, and we've had a number of meetings. I think we probably have a meeting, usually a Zoom meeting to be fair, but it's still a meeting where we have maybe 20 or at least contributors to that there. And I know the Honourable Lady, forgive me for not remembering her constituency right at this moment in time, but she and I would be on that Zoom meetings on a regular basis. I'm going to frame my comments around the latest initiatives and the current policy direction. I'm indebted, and I want to say a few thank yous, first of all, if I can, to Sarah Sleet and her wonderful team at Asthma Lung UK for their outstanding help and ongoing support. They have been enormously helpful to me and indeed to the APPG, and I suspect the other members who have made a contribution or will make a contribution here today. So I welcome their latest report, A Mission for Lung Health, which was launched on Tuesday, and I was at that APPG, and some of the members who are here today were at that as well, and many others who unfortunately can't be here today were also. It's the first time I met Dr. Jonathan Full, the National Clinical Director for Respiratory Disease, for his expert advice and counsel. I've always seen him on a Zoom on your laptop, and that is, I met him in real life, able to shake hands and say hello on Tuesday past. My thanks also to Dr. Richard Russell from the British Thoracic Society, BTS, for his insights and opinion, and pay tribute, Mr. Chairman, to the ongoing work of our expert stakeholder groups, which comprise senior clinicians, industry, professional bodies and other experts. Whenever you have that vast amount of knowledge, experience and input on a Zoom meeting, you learn quickly. I learn quickly of what the issues are. There has been some very welcome developments in respiratory health recently, including the development of a new guideline for asthma, which is a joint collaboration by NICE, by SIGN and the BTS, due to be launched soon. The seasonal flu and COVID vaccination programme appears to have been well planned and is rolling out well this year. And great credit goes, and our thanks goes as well, are due to NH England for their great work. And back home, where it's a devolved matter, I got my 2 injections on the one day, COVID in the left arm and the ordinary flu one in the right arm. It was like a conveyor belt. People were getting in and out about every 5 minutes, or a couple of minutes, I should say. But nonetheless, it really is wonderful to see how well it can work when it goes the right direction and goes well. The ongoing battle with smoking-related respiratory illnesses continues, and the government's plans on smoking cessation, including the tobacco and vape bill, is very welcome. I understand that tobacco and vape bill is coming either next week or certainly the week after, and we hope it will bring a big impact in more deprived areas and on COPD outcomes. Very clearly, when we were doing our research and having our meetings in this here and doing our inquiry in this, the issue became clear where it was more an issue in deprived areas and areas of disadvantage, and I will say a wee bit more about that later on. I hope that this debate today will help to anticipate and highlight World COPD Day, which falls on the 20th of November, which will just be the week after next, I understand. I'm sure the Minister is well aware of the headline figures on respiratory health in the UK, and they are worrying. And I suppose, Mr Chairman, the issue for us why this debate is so important is because the evidential base that we all have in front of us tells us this is something that's not getting better, which is why I'm looking for the Minister today for some succour and some support and probably some easement of mind in relation to where we are. Respiratory disease is the 3rd biggest killer in England. In the UK, 7.2 million people have asthma, while 3 million people are affected by COPD. These aren't just figures, these are people, Mr Chairman, and their families that are affected by that as well. The UK has a higher death rate due to respiratory illness than an OECD average, and the highest death rate in Europe. My goodness, if that doesn't scare you, it should. And over the past 10 years, over 12,000 people have died from asthma, which are all preventable. And I suppose that's the reason why we're having the debate as well, because if we can prevent deaths, well, then we should be doing it. And that's why it's important to have this on record. Absolutely, yes, go on.
Thank you, Jim. I would just like to add on that point, and I'd like to thank you, Mr Rossendale, for your chairmanship. I apologise. As an asthma sufferer myself, one of the key elements to ensuring that we're getting the care that we need is that annual survey with your clinician or your GP about how your symptoms are either deteriorating or improving. And I know many asthma sufferers who aren't getting that annual review with their doctor, and some are going years without any sort of review of the type of deterioration of their symptoms that they're getting. And with that really concerning number of the amount of people that die in this country from asthma attacks, isn't it time that we did more to make sure people are getting those yearly reviews that they really need?
Thank the honourable member for that intervention, and he's absolutely right, because when it comes to addressing asthma, if the deaths are contributable to those who should be getting regular examinations and regular appointments with their doctors or consultants, then it's something that has to be addressed. And I'm quite sure that the Minister is taking notes of this, and their civil service staff behind and PPSs will be making sure that the information is contributed to this debate. NHS waiting lists for respiratory care have risen by 263%, 263% over the past decade. Poorly controlled respiratory disease results in hospital admissions doubling during the winter period. COPD exacerbations are the 2nd most common cause of emergency hospital admissions. These are worrying figures, as worrying as the intervention Dylan Ridgetman referred to as well. New research presented at the European Respiratory Society showed that severe asthma biologics uptake is disastrously poor, with a national median by patients with severe asthma in England between 2016 and 2023 at 16%. An uptake varied widely among ICBs between 2 and 29% against a target of 50 to 60. These are worrying figures which unfortunately indicate a trend that should concern us all. The burden of respiratory disease disproportionately affects the most deprived adults in the poorest 10% of the country are more than 2.5 times more likely to have COPD than those from the most affluent. The 10% most deprived children are 4 times more likely to require emergency admission to hospital due to asthma than the least deprived. Again, figures that show a fall down and a need to focus upon these areas. The lung conditions, especially asthma and COPD, cost the NHS £9.6 billion in direct costs this year and every year. This represents 3.4% of total NHS expenditure, and they cause 12.7 million lost work days per year. Stats again that indicate a massive problem which needs to be addressed. They cause wider reductions in productivity due to illness and premature death, totaling some £4.2 billion a year. They have an overall impact of £13.8 billion on the English economy. All these figures, all these stats tell us we've got a major problem. And one of my major asks today, Minister, if I can put it on record, if you don't mind, is I see that this is an issue that needs prioritised within the NHS. It was prioritised, I understand, within the previous government, but obviously not acted upon because of the election. So I'm asking now, respectively, if it's something that we could have in our strategy for the time ahead. Improving respiratory outcomes will help to achieve government's ambitions to improve the nation's health, halve the disparities in health outcomes, eliminate waiting lists, break the winter crisis cycle, and enable everyone to live well for longer. And some of the reasons for that we've indicated in the interventions and the contributions today, and others who will contribute shortly. So a number of questions to ask the Minister, and I think my staff, Mr. Chairman, have sent the Minister my contribution and the questions I'm going to ask. So I'd like to ask the Minister if she will confirm that respiratory health will be a priority for the Government, and that's my first big ask. The APPG strongly supports the Secretary of State's 3 shifts, which were announced following the Darcy report. I very much welcomed the Darcy report. I thought the Health Secretary of State has done extremely well. A difficult portfolio to take on, but I think the Minister, the Secretary of State, has indicated that he's got the ideas to take it forward strategically. And today we'd like to have some ideas how it will happen for those with respiratory health issues. The APPG and the Darcy's report reported advised analogue to digital. And certainly, we've got to get our data and our medical system onto a better system. And the Secretary of State said that in the Chamber. I heard him saying that, by the way, and I was very encouraged by that when he referred going from analogue to digital. Hospital to community is the second one, and treatment to prevention. Those are all 3 things we should have at the front of where we are. They all have an important part to play in improving outcomes, and I will touch on these in my remarks, and I know others will do likewise. Government is right to highlight the impact of inequalities and deprivation on people's health, and we strongly support their plans for this through the 3 shifts. So government has set a strategic issue with the 3 shifts that they put in place. It is clear from the statistics that we have to improve outcomes for some of the most vulnerable people in society. And our duty, always our duty as elected representatives, Mr. Chairman, will be to look out for our constituents, number one, but to be there for those who are vulnerable. That's why we're elected representatives, because our duty is to look after those who are less well off, those who are physically vulnerable, those who are disabled vulnerable, those who have other issues in the lives that they have. We know that the mortality rates from respiratory disease are higher in disadvantaged groups and areas of social deprivation, those with higher exposure to air pollution, higher smoking rates, poor housing conditions and exposure to occupational hazards. This has to be a major focus for us all. And the trial of the neighbourhood health centres could, I believe, offer a significant shift from hospital to the community. Again, I understand that's something that government's considering, and if it is, that's a good step in the right direction. We hope we will enable a better focus for diagnosis and treatment of respiratory health, which could help reduce the inequalities. As the burden of respiratory disease disproportionately affects the most deprived parts of this great country, and the winter pressures are higher in those areas, then the centres need to be able to match the local challenges. So perhaps again, Minister, we can have some indication of how that will happen. And part of this challenge, Mr Chairman, has to include spirometry testing, which is an essential diagnostic for asthma and for COPD. The community diagnostic centres currently offer very few spirometry tests, and some offer none at all. So again, Minister, second question, if I can put these down if you don't mind. I asked the Minister to confirm that spirometry is widely rolled out, especially in deprived areas where we need to have a new way of helping that its widespread use in primary care in those deprived areas. It would be extremely helpful if spirometry could receive sustainable funding to be equitably delivered. Again, Minister, your thoughts on that would be much welcome. As the Minister will be aware, the National Screening Committee has recommended introducing a targeted lung cancer screening programme across the UK. However, the screening programme only explores the possibility of lung cancer and unfortunately doesn't focus on addressing incidental findings of undiagnosed COPD identified during the screening. Including these findings would enable the neighbourhood centres to help deliver better care for COPD. We are very aware, Mr Chairman, very aware of some work being undertaken in Hull to roll the incidental findings into potential COPD diagnosis. And I would ask the Minister and indeed NHS England to look closely at the outcomes of the study. That study, I believe, Mr Chairman, will give a directional way of what needs to be done in the United Kingdom. And we're greatly grateful to those in Hull who are involved in the COPD diagnosis. The guidance of the National Screening Committee on COPD has not been reviewed since 2019. Again, I would ask the Minister, are there any plans to revisit this to bring it up to date? If it's been 5 years since it's been done and the figures indicate a worrying trend of more disease, then we do need to have that in place. And the SABA overprescribing still remains a big problem. The guideline will be of enormous help in this. And again, I ask the Minister to ensure the full support for the NHS to implement and pull through new guideline. The APPG has been looking at the impact of inequality for some time, and we highlighted this in our COPD event in the House at the end of last year. Well attended, constructive comments, and very clearly, as we do always in the APPG, is off the backs of that have a way of focus, a strategic way of looking at focus, and then a number of asks. The APPG has been looking at the impact of inequalities for some time. And that was why we did that. We intend to take this further and look to hold regional events to enable local clinicians to inform us what more needs to be done. There's nothing better, Mr Chairman, than asking clinicians what the best way forward is, because they know they're dealing daily with their patients, and we're dealing on a regular basis with their constituents. So that helps us to focus attention specifically on prevention. The number of asthma deaths are far too high. They're worryingly high, and the Honourable Gentleman referred to that in the intervention. It has to be a priority for us all to reduce the deaths as quickly as possible, and for this to be an integral marker in the 10-year plan. So the Secretary of State has given us a 10-year plan. Perhaps the Minister can tell us today where asthma and respiratory health focuses in the 10-year plan. It needs to, and hopefully that will be the response from the Minister today. We are 10 years on from the NRAD report, and very little has changed in terms of asthma outcomes. A recent study has shown that people on lower incomes reported greater use of oral corticosteroid use than people on higher incomes. These findings highlight that for people with asthma and COPD in more deprived areas, this may lead to an increase in OCS prescriptions. The study results are similar to those reported in the 2019 survey by Asthma and Lung UK. Again, I would urge the Minister to keep an eye on the study to see what lessons we can learn. I know the Minister is committed to making things better, and we support her in her quest to do so. But I believe that there are many who have helpful contributions to how it can be done better. The APPG also welcomes the improvements in inhaler technology, specifically the move to combination inhalers, which will ultimately eliminate the use of twin inhalers. This should benefit both asthma and COPD patients and will contribute to the NHS's net zero targets. There's lots of things have to be done, and I think the net zero targets, which we all subscribe to and need to be addressed, this is a way of using this better and achieving two goals with one by doing things in a certain way. We welcome government's commitment to increase the workforce in the NHS. Already good news as well. We will see how this looks in the workforce plan next year. Again, I asked the Minister that with a significant increase in staffing levels of primary care, that we will see an end to untrained staff undertaking annual asthma reviews. I don't want to be too critical. It's not about being critical. It's not my nature, Mr Chairman, but I do feel if there's an anomaly somewhere we have to address it, it has to be said. The APPG warmly welcomes the promises of the outcomes of the 10-year plan. We will be submitting our response to the consultation. To have any real impact on respiratory health, though, we believe that the plan has to be disease-specific and contain suitable outcome measures for respiratory health. Will the Minister confirm that the plan will include disease-specific measures for respiratory health? And again, I would ask the Minister to include benchmark metrics at the start of the plan and factor in regular outcome updates at 3, 7 and 10 years. If we do that at that 3-year, the 7-year, the 10-year, then we can chart the progress or possibly lack of progress and improving that. These metrics could include data such as asthma deaths and reduced hospital admissions for asthma and COPD, especially winter admissions, prescription data and reduction in asthma and COPD incidents in the most deprived areas. Interim data outcomes will enable us to determine if the plan is on track to deliver the customs and the outcomes that we all want to see. The use of biologics is a particular concern to the APG and it features regularly in our Zoom meetings. The figures on the use of biologics in England are simply, I'm sorry to say it, are dreadful. The national median by patients with severe asthma in England between 2016 and 2023 sits at 16%, and the uptake varied widely among ICBs between 2 and 29%, against an uptake expectation within the clinical community of 50 to 60. It just doesn't seem to be working. Biologics treatment has been described as life-saving by our clinical advisors for severe asthma patients. There is both a regional and a wide regional variation in access and an unacceptable delay to the start of treatment. Many patients will need urgent treatment, can wait for years to get access to the services which will prescribe biologics to them. This is, I believe, Mr Chairman, an inefficient use of NHS resource and means the health of patients is deteriorating whilst they wait for the right treatment. I don't want to see that. Honourable members don't want to see that, and I know the Minister doesn't want to see that. We need more easily accessible severe asthma services. Again, I ask the Minister to meet with us, if the Honourable Lady could do that, we're much obliged, how we can provide better asthma care for those with the highest burden of disease. And I hope that the NHS innovation and adoption strategy will put forward solutions to tackle low and variable uptake and access to innovative treatments such as severe asthma biologics. The APPG would like to see a funded transformation with the health innovation networks and clinical leadership on the implementation of NICE guidance on respiratory health at neighbourhood level and the delivery of biologics. We're being constructive, if we can say that, Mr Chairman. The Minister knows I will always be constructive, and because I believe that we need to together move forward asking the questions. I've noticed that the Secretary of State's recent remarks and comments on data sharing, and note the call for greater data sharing from Asthma Lung UK in the report. And I quote, improve data collection and analysis across the care pathway to bring together primary and secondary data, make high quality publicly available data which will help the ICSs target care where it is needed and ensure accountability. That we fully support, and I don't think there's anybody in this room that wouldn't support that, because it's absolutely the way forward. We're also looking closely at the recent increase in silicosis cases around the country, especially in relation to engineered stone. It's something that maybe not everybody is aware of, but I know some in this room are, and indeed I suspect that everyone is, to be fair. There's a real threat that the rise in what are entirely preventable cases may add considerably to local health pressures. The Secretary of State has been clear in what he's saying, that we need to address the health waiting list. We need to address the have more action to prevent cases, and I think we have suggested that this is one that needs to be done as well. There are a number of recommendations in our silicosis report, and a key recommendation concerns wider data sharing between primary and secondary care. Finally, the APPG will be holding a round table in the new year to ensure timely discussion to inform the 10-year plan. Could I ask the Minister if she would be most kind and put it in her diary, and we would ask her to come along to that if she doesn't mind. We're not here to give the Minister a hard time, but we're here to take the Minister's contribution and to help us together to move forward. So if that's okay, I know the PPS is... you're not nodding because you can't do that for the Minister, but you are indicating that I'll send you on the date, okay, if that's okay. Since 2015, 250 to 300 patients have been diagnosed with CF each year. Despite medical advancements in recent years, the 2022 median age of death for those with CF was just 33 years. Wow. Think about that. Cystic Fibrosis Trust has called for greater financial support for people with cystic fibrosis for a number of years. And in 2023, University of Bristol study reported that a typical family with cystic fibrosis loses £6,800 a year due to extra costs caused by living with this condition. There are multiple requests from the CF Trust, including the need for government to explore additional innovative market incentive options to encourage the industry and others to fund research and trials for new antibiotics due to the current resistance. I believe we've seen a good and positive contribution to research and development, but I do feel we're probably at a cusp in where we are, where a bit more investment, a bit more help, and we will get it over the line. We need to prioritise diagnostics for antimicrobial resistant infections to prevent further lung damage. The final request, Mr. Chairman, they have highlighted is to implement an early warning alert system on pollution for people with respiratory conditions. And with that, I'm in my last paragraph, Mr. Chairman. I'm looking forward to hearing what others have to say, but the fact of the matter is that we have an opportunity this time with a government who are spending $22 billion in the NHS. That's a massive amount of money. Every person in this great United Kingdom of Great Britain recognises what that means, and it's a time to get it right. And the Minister, the Secretary of State, has indicated that he is of that mind. I know the Minister is also of that mind. So we have an opportunity to make effective change, which will change the lives of people throughout this great United Kingdom of Great Britain and Northern Ireland. The $22 billion, some of that will come in the Barnett consequential dust in Northern Ireland, and that's good news as well. So it means that everybody gains across this great nation. So now I believe is a time to act. We want to do all in our power in the APPG to inform and to support and guide, hopefully, the Minister and her department in effecting change and improving the quality of lives for those with respiratory health. Thank you, Mr. Chairman.
The question is that this House has considered respiratory health. Adam Jogi.
Rosendale. I want to start by joining in the tribute to His Majesty the King as he marks his birthday today on behalf of my constituents in Newcastle and Lyme. It's excellent to see my friend the Minister in her position. I think it's the first time I've had a chance to speak with her on the front bench. It's very good to see her. And I'm also pleased to see that the Shadow Minister's brace has gone, evidence of the wonder of our National Health Service. Now, Chair, I'm grateful for the opportunity to speak in this debate, and I congratulate the Honourable Gentleman, the Member for Strangford, for leading the debate and for his opening remarks. He clearly enjoyed the lack of a time limit and probably enjoyed the 3-hour typo that was in the audit paper, but I thank him for his contribution. And as I start, I ought to declare an interest. My wife is Deputy Sister in an intensive care unit, and I remain in full admiration of her and all of her colleagues who work in our National Health Service on a daily basis. Now, Mr. Rosendale, my constituency is in the middle of our country, and air quality is one of the most important issues experienced by my constituents and one of the most frequently raised issues with me. And it was with that in mind that I was delighted to host the Asthma and Lung UK reception in Parliament on Tuesday this week, where they launched their new report, A Mission for Lung Health. And I encourage all those colleagues across the House here to read that report, and I urge all those watching at home to do so too. Now, Mr. Rosendale, air quality and respiratory health is one of the most important issues experienced by my constituents, and the Honourable Member for Strangford has highlighted the fact that respiratory conditions are the third biggest killer in our United Kingdom, and 1 in 5 of us will be diagnosed with a lung condition in our lifetime. Now, colleagues will have heard me talk about the disgraceful Wally's Quarry landfill site in my constituency. For far too long, the operators have got away with doing whatever they want and leaving our town smothered by the most horrendous levels of hydrogen sulfide emitting from the site. And the levels of hydrogen sulfide have had an undeniable impact on the respiratory health of my constituents. I came down to London on Monday, and I'll be heading back shortly, and I've had many reports from constituents back home that it has been horrendous this week. And so for us in Newcastle-under-Lyme, the fight for clean air is personal and it is constant. And I will make clear again, Mr Rosendale, as I have the opportunity of the floor, to reiterate to the Environment Agency, if they're listening, that we need them to issue a closure notice to Wally's Quarry Limited with immediate effect. We need to cap the site and then restore it safely and swiftly.
Would the honourable member?
I will happily give way to my West Midlands friend.
Yeah, West Midlands posse here. I would just like to pay tribute to my honourable colleague for the work he's done to bring back attention to the disgraceful scenes that are happening at Wally's Quarry right now. We're having a conversation about the health of the nation, particularly about air quality and the impact of respiratory health. There could be no doubt in my mind the years of the lack of action that has happened on that site has undoubtedly had an impact on people's health, and that can't be allowed to continue.
I thank my honourable friend. We are on the way to getting my constituents the justice they deserve, and I thank him for his support in our effort, led by many of my brilliant constituents, Dr Mick Salt, Lee Bundett-Wolford, Simo Burgess and many, many others who have been fighting hard. Sheila Casey-Hume, I could list many, many people off. They didn't all necessarily vote for me, Mr Rosendale, but they've played an important role in helping clean our air and save lives. Now, Mr Rosendale, in recent weeks there's been a pretty furious rush on behalf of the Borough Council and an increase in demands placed on this new government. Now, that's all well and good, but very little representations that I can see seem to be made by the Borough Council to the previous government or indeed to Staffordshire County Council. And the only theme amongst all three of those institutions is that they are led by politicians of the same party. Now, my message to my constituents is change has come, and I'm determined to ensure that that change delivers. And I hope that after the profit over people approach we've seen from the operators at Wally's Quarry, that we don't now see that politics over people has prevented the site being closed and the respiratory health of my constituents being protected and enhanced. And I would be grateful for an update from the Minister on what cross-departmental work's been taking place across government on these issues. Now, Chair, access to diagnostic testing for respiratory conditions is in dire need of reform, and the example and experiences of my constituents proves that oh so well. Access to spirometry testing for lung conditions, particularly since the COVID-19 pandemic, has been a slow and painful process for too many people across the country. As it's estimated that in our United Kingdom, more than 600,000 people are living with undiagnosed COPD, and the Honourable Member for Strangford touched on this. Even when respiratory conditions are suspected or diagnosed, people are waiting far too long for care. The latest NHS data shows that in Staffordshire, in August, almost 5,000 people, and to be exact, 4,963, were waiting above the national target for 18 weeks to be seen by a respiratory doctor. This is just over 50% of all patients referred for treatment, and while this is higher than the national average, it is sadly not uncommon, but it needs to change. When patients are diagnosed with a respiratory condition, the quality of care they receive often does not meet the standards set by NICE. Asthma and Lung UK has found, and I pay tribute to Asthma and Lung UK for all the work that they do, that 70% of those living with asthma are not receiving all three aspects of basic care. And the care received by over 90% of those with COPD does not meet the 5 fundamentals required by NICE. People, Mr Rosendale, living with undiagnosed and poorly managed lung conditions are more susceptible to environmental factors such as air pollution, wintry weather and poor quality housing, all of which, sadly, is applicable to the communities and people who live in the areas surrounding Wally's Quarry in Newcastle-under-Lyme. And I'd be grateful on this particular point if the Minister could take some time to think about, if not today, happy to talk at another time, about the powers and scope of UK HSA. They have a really important role to play, but currently most of it's advisory, and I wonder whether we can look at strengthening the powers and scope of UK HSA, because they have, as I say, an important role to play. As colleagues have highlighted, certainly the member for Strangford, lung conditions are more strongly associated with deprivation than any other major health condition. Sadly, the result of these combined factors is clear, and as the member for Strangford noted, respiratory conditions are the largest driver of A&E admissions each winter. thousands of people living with undiagnosed and poorly managed respiratory conditions are ending up in A&E, adding more strain to an already understrained National Health Service. Now, last year, Mr Rosendale, across the Staffordshire and Stoke-on-Trent ICB, 3,765 people were admitted to hospital in an emergency due to a lung condition. Yesterday, my right honourable friend, the Secretary of State for Health and Social Care, reiterated that this new Labour government's ambition to reform our National Health Service. But it's clear that this will not be achieved without prioritising respiratory health and care. This is entirely in line with the shifting focus from treatment to prevention, a focus that has my full support, and from hospital to community care, where actually most respiratory care happens anyway. The Department should introduce a recovery fund of over £40 million over 2 years to increase the availability of testing. This would result, and I know it's a big ask and I understand the financial pressures, but it would result in savings of £80 million for the National Health Service related to reduced exacerbations and a reduction of 85,474 hospital bed days. Now, lastly, Chair, I want to touch on the link between waste crime and respiratory health. This morning, I received an email from Councillor Robert Betley-Smith, the Chair of Betley Parish Council in Newcastle and Lyme, and despite being in a different party to me, I do appreciate the spirit in which he works with me as we seek to serve the people who elected us. And Councillor Betley-Smith noted the continuing activity on the land at Doddlespool Hall Farm in my constituency, and I won't go into all the detail, but the link between waste crime and the disposal of waste generally has a huge impact on respiratory health. Councillor Betley-Smith noted that apart from the waste issue, there appears to be evidence based on smoke and smell that tyres or similar materials are being burnt and have been burnt in the last week or so. The failures to regulate the waste sector under the previous government must be put right by this new one, and I look forward to working with ministers across government to do exactly that. There is a financial issue here, there's an environmental one, and of course there's a health one too, and I urge my friend on the front bench, the excellent Minister, to ensure that respiratory health is prioritised in the forthcoming 10-year plan for our beloved National Health Service and, importantly, in the upcoming review of the long-term workforce plan as well. I'm grateful to the member for Strangford for introducing this debate and look forward to working with him, the Minister and colleagues across the House on these issues in the months and years ahead.
Yeah. Thank you, Mr Rossendale, and it's a pleasure to serve under your chairmanship. And I thank the honourable member for Strangford for securing this debate. We've spent many years working on these issues together on the other side of the chamber, at the hall. And as we've worked together as part of the APPG on respiratory health. And I'd like to pay tribute to the work of the members of the APPG, clinicians and patient organisations involved with the group, including Asthma and Lung UK and Action for Pulmonary Fibrosis. Now, respiratory illnesses, Mr Rossendale, have a disproportionate impact on the most deprived communities. In my constituency of Blaydon and Consett, the rates of conditions such as COPD are particularly elevated. And I've seen firsthand in my surgeries over the years how debilitating these conditions can be. They can affect every part of a person's life, from their mobility to their mental health. Tackling these conditions is key to tackling health inequalities. Now, deprivation is not only linked to heightened rates of respiratory illness, but also faster rates of progression and poorer outcomes. This is true for terminal diagnoses such as pulmonary fibrosis, which has outcomes similar to common cancers, as well as for more common conditions such as asthma, where we've seen a 25% increase in deaths over the last 10 years. Now, we know that the biggest driver of preventable lung disease is smoking, which is responsible for half of the difference in life expectancy between our richest and our poorest communities. I am pleased that this government is taking the decisive action that is needed to protect future generations through legislation. And I am particularly proud, Mr Rossendale, of the work being done in the North East and has been done over a number of years by Fresh, which sees public health and the ICB working together to tackle this issue. Now, access to timely diagnoses and appropriate clinical pathways is vital for ensuring that people get the best possible treatment. But such access varies between conditions and areas of the UK. Of around 1.7 million people living with COPD in the UK, 600,000 are undiagnosed. Meanwhile, 1 in 3 people have never heard of pulmonary fibrosis, which can lead to people receiving incorrect diagnoses, such as asthma. And incorrect diagnoses of severe asthma are also common amongst children with the genetic condition primary ciliary dyskinesia. This is not a mild condition. In fact, children with PCD, I'm not going to try and say it again, have a worse lung function than children with cystic fibrosis. And it's vital that we do what we can to raise awareness of these conditions and this rare condition of PCD and their impact, whether these conditions are primarily genetic in nature or driven by preventable causes. Now, we know that our NHS is in a really difficult place following 14 years of Conservative mismanagement. Those years, we lost 14 years in which we could have made progress to improve the lives of people living with these conditions, but instead they were left extremely vulnerable to the pandemic following a decade of underinvestment and disastrous top-down reorganisation by the previous government. And that's not the fault of our NHS staff, who are working hard to provide services in very difficult situations. So I want to be clear about that. But the state of our health service at present was laid bare in the Darzai report just a few weeks ago, which spoke, among many other things, specifically about the poor outcomes for respiratory conditions in people with learning disabilities, as well as the link between the rise in these conditions and the growing levels of damp, often in the private rented sector. We have a long road to travel to fix the problems that we've inherited, but I am proud to serve under a government that's committed to a huge investment in our NHS and has already made key steps towards a prevention agenda. Better public health and community care will be really important for tackling respiratory conditions and the shocking health inequalities that follow from them. And I know that this government has a sharp focus on looking at preventative measures, such as those mentioned by my honourable friend, the member for Strangford, and will be looking at how best we can work on improving our access to diagnostics and treatments, including biologics, for respiratory health.
Michelle Welsh.
Thank you. I want to thank my honourable colleague for bringing this important issue forward today. Lung diseases in my constituency of Sherwood Forest are sadly prevalent. Diagnosis is often slow and prognosis is often devastating. Health inequalities in my constituency are stark, with people in the south of Nottinghamshire living on average 7.5 years longer than those living in the north of my constituency. Significant work across Nottinghamshire is being done regarding the diagnosis of lung cancer, and rightly so. But there are serious gaps in pathways for those suffering from lung diseases such as pulmonary fibrosis. Pulmonary fibrosis is a devastating disease, and its impact is felt acutely by those affected. I know firsthand that this relentless and often rapidly progressing condition drastically changes the lives of people affected and their loved ones. They face a daily struggle of breathlessness, constant fatigue, and the immense mental toll of facing a terminal illness with very limited treatment options. Simple tasks like walking across a room become an enormous challenge. Yet pulmonary fibrosis lacks the focus it desperately needs. Many people receive their diagnosis far too late, partly because the symptoms are often mistaken for less severe respiratory issues, and long waits for access to specialist care and life-extending treatments are very common. The disparities in access to these life-enhancing resources are unacceptable and must be addressed. Health inequalities also play a significant role in accessing pulmonary fibrosis care, with those coming from a socially deprived background and living further from one of the few specialist centres being likely to die sooner. I welcome the message of the Secretary of State in calling for more of this specialist care to be available closer to home, something which is particularly problematic for pulmonary fibrosis. I welcome the work of the National Charity for Action for Pulmonary Fibrosis in bringing together the community in efforts to implement a new pathway to improve many of these issues, and I hope that the NHS will continue to focus on the implementation of this work. We have the opportunity to redesign services in a way that better aligns with local population needs and therefore enhances patient outcomes. I wish to place on record my thanks to those working in the Nottingham University Hospital Trust in respiratory care, in particular the lung nursing team, the healthcare assistants and Dr Saini, who I know are working endlessly to improve both diagnosis and prognosis. I know this firsthand, as sadly my father suffers from this core disease, and I've subsequently met many others who are suffering and their carers. People with IPF are often misunderstood, with no known identified cause. They often feel lost and always feel ignored. The work to improve healthcare systems for pulmonary fibrosis is something that requires collective effort, and I hope that today's debate will pave the way for significant strides forward in how we address this heartbreaking disease, so those suffering are heard and they are understood. Yeah. Thank you.
Danny Chambers.
Thank you for calling me to speak in this debate, Chair, and to pay tribute to all the hard work that my honourable friend from Strangford does on the APPG for respiratory diseases. And as people have touched on, it's a hugely important issue with the sheer number of people affected by this and being killed by this every year, and also the huge amount of resources it takes from our NHS as well. It was really good to see everyone talk about a holistic approach to this, because it's not purely about NHS services. Most people who are speaking have discussed the importance of air quality and pollution, and it was acknowledged by the member for Blaydon and Connaught that people living in poverty are more likely to suffer. I think it's 3 times more likely to die from COPD, or no, 5 times more likely to die from COPD, and about 3 times more likely to die from asthma. And we know there's a whole variety of reasons for that, one of them being air pollution. And certainly in Twyford, the little village of Twyford near Winchester, where one of our fantastic Lib Dem councillors have been campaigning for years to improve air quality, reduce pollution due to traffic, and that is, and she's a former doctor, and one of her main motivations for that is to try and improve asthma and children's respiratory health. The Minister and I were here about a week ago, I think, discussing housing, and it was acknowledged that that in the UK we have the oldest housing stock in Europe, with a lot of it being built before World War II. And once again, the link between people living in poverty and living in substandard housing is very strong. And I'm probably not the only member who receives correspondence from individuals who are in sort of private housing association accommodation and struggle to get response from some of these organisations when they encounter problems like mould. And we know that living in substandard housing is not only poor for your physical health, but it's also, it's bad for the environment, it's bad for CO2 emissions. And we did discuss last week about a sort of a huge programme to try and improve the housing of people living in poverty, because it's good for the environment and it's good for people's health as well. And we should remember that about £1.5 billion a year is spent by the NHS dealing directly with issues that have arisen from people living in poor and substandard housing, like damp, too cold. So the sort of comorbidities are huge in this. And I'm very mindful to talk about sort of clinical treatment of respiratory diseases when the Shadow Minister is actually a doctor and I'm merely a rudimentary veterinary surgeon. But one of the very common diseases we treat in horses are respiratory diseases. And by improving the housing of horses, the surroundings that they're in, we can get the huge majority of them off medication entirely. By getting rid of dust, improving ventilation. The same with groups of cattle which are housed over the winter. It's a huge impact on farmers' productivity, respiratory diseases, but a combination of improving the accommodation, improving the ventilation and vaccination means that you get fewer illnesses, you get much better productivity, it's more cost effective for the farmer, and you use much fewer antibiotics. And that's and it's exactly the same when we look at public health. You know, trying to treat people who've got sick because they're living in the substandard conditions is going to be an endless task, whereas actually getting to the root cause of the problem will end up having huge knock-on effects throughout all of society. I did just touch on vaccination. And you know, vaccines sort of in human and veterinary medicine are always the most cost-effective health intervention. It's better for patients, it's better for the taxpayer, and really importantly, it does help us avoid using antibiotics unnecessarily. And the World Health Organization has noted that antimicrobial resistance is one of the biggest global health challenges that's facing the world right now. And interestingly, as we touch on vaccination, vaccine hesitancy is also recognized as one of the biggest global health challenges right now. And so we should be looking at how we're certainly monitoring levels of vaccination uptake, because we know that we've got this sort of triple demic, as people call it, especially going into the winter, but actually all year round, of flu, of COVID, of RSV. And slightly concerningly, it seems as though about 280,000 NHS staff, or fewer of them, have been vaccinated this year compared to 2019 levels, even though there are slightly more frontline staff now. And so I'd urge the Minister to explore why this might be the case. Is it due to concerns over the vaccination, or is it due to just lack of access to vaccinations? For example, I want to get vaccinated and I just haven't had time yet this year. So this could be the situation for many people. And also importantly, including the vaccination of mothers with RSV who are pregnant. That's a hugely important intervention that helps prevent babies under 6 months old getting really sick. Most people just get a cold from RSV, but it's about tens of thousands of babies every year admitted to hospital with this, and it can be hugely damaging in the long run. While we touched on sort of holistic approaches to respiratory disease, it's worth looking at other health conditions as well. The member for Strangford did mention the work on smoking cessation, which is obvious and hugely important, but it's also worth noting the work on obesity as well. If you are obese and you have underlying respiratory issues, it's much more difficult to manage and much more difficult to treat, and the symptoms often exacerbated. And so, improving quality of food, including in free school meals, all the public health interventions that we need to be focusing on. And I really hope that, given the financial constraints that we're working under at the moment in the NHS, is that we won't view public health as a cost to be cut, because we know in the long run we desperately need to invest in public health to stop people getting sick and stop them ending up in hospital. We won't prevent every disease, no matter how hard we try. People will still get sick for a whole variety of reasons and need long-term management, and COPD, asthma, lung cancer. And one thing that we're, in our manifesto that we're really calling for, and we sort of reiterate again, is for people with long-term conditions to be able to see a named GP so that they get continuity of care, someone who is very familiar with their case, and they don't have to see someone different every time, because that does cause a lot of stress for patients and sometimes results in miscommunications as well. So just to finish up, we're discussing air pollution earlier today. Back during the general election, we were calling for a new sort of Clean Air Act, which is based on World Health Organization sort of recommendations, and ideally sort of being enforced sort of by a clean air agency. So we'd really ask the Minister to look at these proposals seriously and see what other sort of suggestions you could make about really working hard on local pollution levels, improving vaccination rates, improving housing standards, and also ensuring that anyone who has a diagnosis of any type of cancer, but particularly lung cancer, gets to see a consultant within 62 days of being referred. Yeah, yes, of course.
I missed it to say what a pleasure it was to serve under your chairmanship earlier on. I just want to get that on the record. Before my election to this House, I spent 5 years working with the then Shadow Minister for Air Quality and spent a lot of time working on these issues, particularly around the World Health Organization guidelines. Would the Honourable Gentleman find some time to have a cup of tea with me so we can see what we can do together to make the progress we all want to see?
Yes, I will.
Okay.
I live off tea. It's the only way I get through the day. So, and I'm also have a particular interest in air quality. So this could be a really enjoyable meeting. And as this, I was going to say, as this debate didn't go on as long as you'd like, you could come and speak with us as well. But yeah, the Clean Air Act and the name doctor, and I just take this final point just to say we are heading into winter. We know the NHS the staff must be dreading winter sometimes. It's always busier. There's a whole load of respiratory issues that add to the winter pressures on the NHS. And I'd just like to thank all the NHS workers who are heading into this very difficult time and pay tribute to them and do whatever we can to support them, whether that's helping them get their vaccinations or helping them in any other way. Thank you.
Shadow Minister, Dr. Luke Evans.
Thank you, Mr. Rosendahl. It's a pleasure to serve under your chairmanship. And for me, this is the first day in the brief, and it seems prophetic to be taking this brief over and being in a debate on respiratory illness, considering it was my first ward job as a junior doctor. I worked for 4 months in A&E in the West Midlands, and then my first ward job was doing respiratory in Solihull Hospital. So I've seen up front just how important respiratory medicine really is. And I'd like to put on record my thanks to the member for Strangford for securing this debate. Now, he may often get called last in the chamber, but he's clearly got a trick on how to get debates called so successfully. So I'm looking forward to maybe having a cup of tea with him to understand how he can be so successful in getting debates called. If I can turn to the contributions from the debate so far, to the member from Newcastle-under-Lyme, it's both a blessing and a curse to hear this same argument made by his predecessor about the quality of air in his constituency, and the fact that I gather it's a tip that causes a huge amount of problems there. I hope he has success in getting this sorted. I hope he takes some comfort that the last government did enact the Environmental Act to make sure that legal limits are put in place to try and help air quality and, of course, offer air quality grants. But there is clearly at East Midlands, West Midlands interest in respiratory here with his colleague who's now no longer in his place. Me, having worked over in the West Midlands, now transferred to clearly the better East Midlands and making a representation from here, of course.
Well, I'm very grateful, Mr. Rosendahl, to the Shadow Minister. I will gently push back on this narrative that the previous government made this sort of progress in tackling the issues at Wally's Quarry that he has just implied. My constituents continue on a daily basis to deal with the worst effects of the hydrogen sulfide levels emitting from that site. And hydrogen sulfide is a heavy gas. There's schools around there. The impact on our children and young respiratory health on young lungs is massively underrated and fails to be part of the conversation. So what I'd like to do, Mr. Rosendahl, is invite the Shadow Minister to come to Wally's Quarry and to Newcastle-on-Lyme to smell for himself.
I'm very grateful to the offer. If there's a cup of tea, it may well be a consideration to have too. Maybe we could take all of us as a group cross-party trip from this debate to be there. I'm happy to give way again.
Thank you. Rather than have a cup of tea, because there's been quite a lot of sobriety in this debate, I'll take him to the Wagon and Horses pub in Newcastle and Lyme for a slightly cold refreshment.
I'm very grateful for the offer from there. Turning to the member from Blaydon and Conisset, can I congratulate her for her work in the APPGs? And of course, number one, she is right to highlight smoking as a big problem. And the health inequalities as well is so important. And that leads on to the access. We know people with health inequalities also struggle to generally access healthcare, let alone for respiratory conditions. And we haven't even gone into talking about the equipment and the expertise that you need in this area to deal with that. To the member from Sherwood Forest, pulmonary fibrosis. Really important condition, not given the precedent it deserves and how debilitating it is for patients who suffer with this. So may I give her a special tribute for raising up so powerfully, so emotionally, and she's a true champion for doing something for a condition that is not thought about nearly enough. Turning to the member from Winchester, he's absolutely right with his holistic approach, and it's outside of the remit of this debate, but of course housing, environment, smoking, as we mentioned, all play a big factor. We haven't even talked about comorbidities yet. We usually know that people over the age of 60 are usually on several medications, may have heart problems as well, may have musculoskeletal problems. This is going to cause a really big impact. With regards to him being a vet, I think I'm still right in being correct, is that he is allowed to practice on humans, while I certainly am not allowed to practice on pets. Now, this is not for a debate today, but something that I think is, if there is a problem, you should rush to him too. And his point about antimicrobial resistance is really interwoven into everything here, because actually there is a danger that overprescribing prescriptions for chest infections when they turn out to be viruses is a really problematic issue that is growing and is the next probable big pandemic with no easy solution. So he's right to highlight that. Turning towards the APPG, may I thank them for all the work they do, led by the member for Strangford. It's really important to be able to get a debate and raise these issues and to have the infrastructure behind the member to support the team in dealing and producing updates here. And when it comes to respiratory medicine myself, I actually have a personal history, having ended up on the intensive care unit with bilateral pneumonia after an appendectomy in my late 20s. It's left me under, at previous times, at the Brittle Asthma Clinic. And I myself had many attempts to diagnose what was going on, but nothing ever found, but had to be treated with repeated steroids and have felt full on what it's like to suddenly not be able to breathe, not be able to exercise, and have that taken away from you. And I think listening to what's this debate, the key one for the public to realise is just how important your breathing really is. And a breathing condition is so seminal in everything you do. There's a reason why you come to an emergency, it's an A, B, C, D, E, airway, breathing, circulation, because breathing is quite literally life. And having that taken away from you, as many people have experienced to a little bit by getting COVID, has at least made people aware of just how bad viral illnesses can really be. Turning to some of the other conditions that we haven't talked about, I feel like I'm being back in one of my medical exams in the 5th year, because we've heard talking about asthma, COPD, but we haven't talked about pulmonary embolysis, pneumoconiosis, TB. We did hear about cystic fibrosis, but we haven't heard about mesothelioma, sarcoidosis, and pneumonia is a really important one to talk about too. And finally, lung cancer. These conditions, there's probably some I've missed as well, are really important, but make up that third place for all deaths, and respiratory conditions therefore need that attention. So I was pleased to see that the government, the last government, did come forward with the community diagnostic centres, 170 community diagnostic centres going up across the country to get better access, be it MRI scans, CT scans, blood tests. These are going to be really important. And I myself in Hinckley were lucky to have a £24 million investment of a CDC there, which will have MRIs, CT scans, and it's being built as we speak. So that will really be transformative for my community when they're caught between two big centres going towards Nuneaton and Leicester. I hope that means that when we look forward, that when it comes to the hospital rebuild programmes and the current review that's going on, this respiratory conditions will play an important part in making sure we have the apparatus and equipment to be supportive for there. If we turn into the nitty-gritty of the debate, I entirely agree with the idea of prevention. And so this side of the House brought forward measures to deal with smoking, and I hope to be seeing, as the government steps forward with its further ideas of how to deal with smoking and push for a smoke-free generation, we'll be looking at that very closely. The member for Strangford really hit on a point about data. Most health policy must be driven with decent data. And I think the APPG works highlights how the respiratory conditions tend to fall behind on that. So questions to the Minister about what work is being done on how we can join up that data set, not only from simple things of how we record things, but also in my constituency, for example, we have two boundaries we call between North Warwickshire and Leicestershire. And to get some of the answers to the tests, an asthmatic doesn't have an asthmatic an asthma attack, directly where they live. They could be on holiday. Yet sharing that information of what's happened, what treatment, what investigations have all been done is really important. And that leads me on to the next question. We heard it about spirometry being raised. Spirometry is really key, and it's too sporadic about where it is and how to achieve, plus the skill set to be able to deliver spirometry. And then, of course, we have pheno when it comes to asthma as well, fractional inhaled nitric oxide, which can help aid the diagnosis of asthma. This is going to be really key, and I'll be looking forward, in this side of the House, we'll be looking forward to seeing what the new BTS guidelines worked up with NICE actually show when it comes to dealing with asthma. And a couple more questions for the Minister. Now, I do appreciate this isn't her brief, so I'd be grateful if she's able to pass any questions she can't answer on for a letter response. Because we did hear the likes of RSV is really important, these new vaccines that are coming out that cause a huge problem for the elderly and young. And I know that it was introduced between those who are aged 75 and 80, but it'd be interesting to see if there's a scope to be able to grow that, to see who else is responsible. And I gather from work done by my colleague on the opposition bench, that there is still some debate and evidence to be gathered of what this would look like. I'd really appreciate if the Minister would take that away. Also, what steps they are taking to increase the uptake of flu and pneumonia vaccinations, because, again, prevention is better than cause. And finally, it was mentioned as well that the last government did look at chronic health strategies, and it does appear that the new government has decided to take a different tact when it comes to dealing with chronic conditions. While I appreciate that's prerogative, there is a danger that we could have a lag in terms of how data that has been gathered, research has been looked at, policies that have been structured for the last 5 years or so, could fall by the wayside while we've heard how important and how much of an emergency it is to deal with respiratory conditions. So I'd be grateful if the Minister would be able to clarify whether parties who are interested, who have done work in this, need to resubmit, whether that work is a continuation work within the new structure that the current government is planning. And if there are any timescales on what this would look like, because clearly the Conservative government was unable to get this long-term health strategies in place in time before the election, and time is ticking on with a winter coming up. It'd be really important for these organisations to understand where they stand. And with that, with Christmas coming up, I certainly know from my time, and I declare an interest with my wife being a GP as well, Christmas is the busiest time, and respiratory conditions are one of the top reasons for it. So number one, if anyone is listening out there, to get vaccinated is an imperative, and I would advise everyone to do so. And to the staff within the organisations, we know that they will go above and beyond when they see someone struggling for breath. They will take their time to get that history right, get the medication and treatment in place. And our greatest thanks from this House, and certainly this side of the House, and I'm sure shared by the other side too, for all the work they have done and will do in the Christmas busy period.
Call the Minister Karen Smith.
Thank you, Mr. Rossendale, and it's a pleasure to serve under your chairmanship for the first time in this new role for me. And I would like to start by thanking the Honourable Member for Strangford for securing this debate on what is a really important issue this afternoon, and other members for the contributions they've made. As the member opposite said, I am covering for my honourable friend, a member for Gorton Denton, but I'm really pleased to do so. And it's a bit of, we've had an outing this morning, and I was able to talk with the honourable general opposite earlier, but his first ward area was in this area as a medic. I must say he is getting his money's worth out of the NHS at the moment, and I hope he doesn't have to do that again. But also, one of my jobs as a manager some 15 years ago was with the British Thoracic Society and primary care leading physicians around COPD, and on a project that was about living and dying with COPD and helping people to understand the disease and how to navigate living and dying with it. And I learned an awful lot about respiratory disease at that time, and how people live and die with that, and I commend that work. But what I am shocked at is really some of what we've heard this afternoon, and in preparing for this debate, really quite how
poor some basic preventive measures that we were talking about some 15, 16, 17 years ago are still not in place. So I am really happy to be responding here this afternoon. And the first thing I'm able to do, I'm not sure I'll be able to satisfy everybody's contributions, but I can respond on behalf of the Minister for Public Health and Prevention, the member for Gorton and Denton, that he'd be happy to accept the invitation to the round table that he talks about. And his expertise will be better there than mine, Mr Rossendale. So that is something we can definitely very keen to pursue that conversation with himself and the all-party group. As we've heard, 1 in 5 of us will be affected with a chronic respiratory disease at some point in our lives, and these conditions are sadly the third biggest contributor to years of life lost in England. Now, many people who are out and about and using public transport will know the symptoms of poor respiratory health. They might associate a wheezing, a raking cough as indicative of a smoker, but not all ill health is about personal choice. In fact, this common symptom belies a huge range of conditions, only some of them related to smoking, each requiring different interventions. And in all of these, we're taking forward a combination of immediate bold actions and long-term reforms. This government is taking radical action to create the first smoke-free generation. We're clamping down on kids getting hooked on vapes, protecting children and vulnerable people from second-hand smoke. Tobacco is a uniquely harmful product, and smoking is the #1 preventable cause of death, disability and ill health. And the statistics are stark, aren't they, Mr Rossendale? Smoking claims the lives of around 80,000 people a year in the UK and kills up to 2/3 of its long-term users. Second-hand or passive smoke is extremely harmful to health. There's no safe level of exposure to smoke. If you can smell cigarette smoke, you're inhaling it. Smoke is harmful particularly to children, pregnant women, or people with pre-existing health conditions such as asthma or heart disease, which may not be visible to the smoker. So our tobacco and vapes bill introduced last week will be the single biggest public health intervention since the last Labour government banned smoking in indoor public spaces. The bill's primary aim is to create a smoke-free generation, gradually ending the sale of tobacco products across the country and breaking the cycle of addiction and disadvantage, so that someone born after 2009 will never be able to legally buy tobacco. Now, this landmark legislation will also enable the government to strengthen the existing ban on smoking in public places to reduce the harms of passive smoking in certain outdoor sessions, and it will ban settings, and it will ban vapes and nicotine products from being promoted and advertised to stop the next generation from being hooked on nicotine. Now, we'll hear all sorts of arguments against these sorts of policies, saying it's nanny state or anti-growth. However, most smokers, myself included, always wish they'd never started. They have had their choice taken away by addiction induced at a young age by the tobacco industry. And I'd like to remind the Chamber that smoking costs the economy and wider society some £21.8 billion a year through lost productivity, smoking-related lost earnings, unemployment and early death, as well as cost to the NHS and social care of over £3 billion. So our actions will save thousands of lives and protect the NHS, and I pay tribute to charities like Action on Smoking and Asthma and Lung UK who've supported our work. Through it, we will create a healthier society and doing so boost the economy. But smoking, as we've heard this afternoon, is only one example of how our respiratory health is influenced by our environment. Now, despite it being almost 70 years since the first Clean Air Act was passed, what we breathe remains one of the greatest risks to public health in the UK. And as set out in the Chief Medical Officer's 2022 annual report on air pollution, there is clear evidence that outdoor air pollution contributes to the initiation and development of respiratory diseases like lung cancer. And that is why the Government is committed to a preventative approach in this area and is working across departments, as has been raised. I want to assure people that this is a mission-led approach to work across departments to improve air quality. We want to address the inequalities in the quality of the air people breathe simply because of where they live. Now, the Department of Health and Social Care will support DEFRA to deliver a comprehensive and ambitious clean air strategy. This will include a series of interventions to reduce emissions so that everyone's exposure to air pollution is reduced. The UK Health Security Agency, we've also heard talked about this afternoon, is working closely with DEFRA to review how we communicate air quality information to ensure members of the public and vulnerable groups in particular have what they need to protect themselves. And I'd like to commend my honourable friend for Newcastle upon Lyme for his work to continue to support his constituents with regard to Wally's Quarry. I know my honourable friend, the Minister, visited recently and he will be pursuing those discussions with the Environment Agency. Thinking about people's homes, This government is also taking steps to reduce respiratory health at people's homes. I think a point well made by the Liberal Democratic Party spokesperson. We know living in a home with damp and mould increases the risk of respiratory illness and conditions such as asthma and COPD. It also affects symptom severity and risk of death for individuals with existing respiratory conditions. So we're putting forward an initial £3.4 billion towards heat decarbonisation and household energy efficiency over the next 3 years. £1.8 billion to support fuel poverty schemes. This means over 225,000 households will receive help to reduce their energy bills by over £200. The excellent points also made, I think, by the Liberal Democrat spokesman about vaccinations and the Honourable Member for Strangford. We do want to encourage, and actually the opposition leader, I think, spokesperson, encourage everyone, including ourselves. I look around the room, even at myself, I'm slightly behind on my flu vaccine, to do all we can to ourselves and encourage others to uptake vaccine and prevent some of these problems. We recognise, though, that not all ill health can be prevented. So we need to act to help those who need treatment. So I do want to assure the Honourable Member for Strangford and other contributors that respiratory disease remains a clinical priority. Now, the NHS long-term plan set out under last government set a series of objectives of improving outcomes for people with respiratory disease through early diagnosis and increased access to treatments. And as we have heard, and as I said in my introductory comments, it really is quite shocking that that isn't happening as a basic everywhere. And access to checks and basic preventive care needs to be much better spread across the country. That's why we say we want to take the best of the NHS to the rest of the NHS. Now, NHS England has got 13 respiratory clinical networks across the country, which are vital in providing clinical leadership across primary and secondary care for respiratory services and supporting services in primary care where, of course, most patient contact is. And if I can just commend the my friend, the member for Sherwood, for her highlighting particularly pulmonary fibrosis. I wish her father and her family well at this time. But she's absolutely right that early and accurate diagnosis is a priority, and it is a priority for NHS England. The work to improve this area is underway, which should have an impact on reducing delayed diagnosis of pulmonary fibrosis. As I understand it, access to these treatments has recently been expanded to patients with non-idiopathic pulmonary fibrosis following the publication of NICE technology appraisal for treating progressive fibrosing lung diseases. So I hope that goes some way to assuring her of the comments that she's made so eloquently here today. Now, as highlighted by Honourable Member for Strangford and my friend the members for Newcastle under Lyme, and made well by my friend for Blaydon and Consett, as well as Sherwood Forest, COPD is a major contributor to inequalities in life expectancy and healthy life expectancy, with people living in the most deprived parts of the country 5 times more likely to die from COPD than those in the least deprived. And I saw this both in my work previously, working with those working in the NHS, but since becoming the Member of Parliament for Bristol South in 2015 in my own constituency, home of the Wills Tobacco Company, which was a huge employer in the area over many decades, and the legacy of that is seen in many very different ways, but particularly in the very high rates of smoking in my constituency, up to 32% in some parts, the reduced lives lived in good health, and those shocking early deaths is something that I see every day and is still very apparent in the shocking statistics of health inequality across my home city of Bristol. So let me assure honourable members here that this remains a priority, I know, for my honourable friend and all of us in this government, because health inequalities and reducing those is a key part of our mission for this government. That does require us to work across government, and it runs across all parts of government. With regard to NHS England, the Core 20+5 is a national approach to inform action to reduce healthcare inequalities at both a national and local system level. And the approach provides a vehicle for targeted intervention to detect and treat these diseases that are major contributors to life expectancy, as well as pressures on the NHS. Now, we know there is a particular risk of the condition exacerbation around winter, leading to emergency treatment in hospital and inpatient care. And that is why the focus of Core 20+5 action on respiratory health this year has been to increase vaccination uptake, including COVID-19, flu and, I'm going to get this wrong, pneumovax, which can protect against serious illness like pneumonia and meningitis. Further, NHS England is leading on the development of an approach for COPD management that will support proactive identification and management of risk of patients in winter to reduce demand on primary and secondary care. And my honourable friend for Blaydon and Consett was absolutely right to highlight the low levels of diagnosis and the numbers of people that are living with COPD and other respiratory diseases, and the impact on children that we might not even know about. But currently the plan is to test and evaluate this approach in 4 sites this winter to help inform decisions on winter planning in the future. On severe asthma and access to biologic treatments, significant work has been undertaken through the NHS England Severe Asthma Collaborative to develop the capacity of the severe asthma centres. This important work includes streamlining patients' pathways to biologic treatment and reducing variation in prescribing and patient management. Patient outcomes are also now submitted to the UK's Severe Asthma Registry. This has shown improved identification of patients with potential severe asthma in primary and secondary care, resulting in referral to severe asthma centres for consideration of their eligibility for this therapy. Now, Mr Rossendale, we also know that action to address avoidable deaths from asthma has not gone far enough. That's why we're working to ensure that asthma care has a higher prioritisation within systems. For example, the National Bundle of Care for Children and Young People with Asthma workstream, which intends to improve outcomes for children and young people with asthma. Looking further forwards, a central mission of this government is to build a healthcare fit for the future. And as honourable members have noted, our 10-year health plan will focus on the 3 shifts needed to deliver a modern NHS, from hospital to community, analogue to digital, and sickness to prevention. This is a long-term challenge and will take time to deliver, and so the plan will consider what we need immediate actions to get the NHS back on its feet and bring waiting lists down, as well as the longer-term changes needed to make the health service fit for the future. I'd like to thank the honourable gentleman for his commitment to respond to our engagement exercise. I encourage all organisations and individuals to contribute to the 10-year plan, and if I can make a plug at change.nhs.uk. We are keen to work with public, patients and our partners in all the organisations that support this work to listen and co-design the plan with them. I know this issue of disease-specific and more general look at quite long-term conditions and people's health is a very live one. With the level of comorbidities that people are currently living with, I think it is important to be looking at the person as well as those diseases, but we will continue to look at that as part of that 10-year plan development, and I know honourable members are all going to take an active part in that process. I'm just checking if there's anything else. The honourable gentleman from Strangford will tell me if I haven't responded. With regard to updates on RSV vaccine that the member opposite asked for, yes, we would, as part of my portfolio work on urgent emergency care, we are looking closely at vaccine update as well as presentation, and I'm sure he is aware, presentation particularly of very young children with respiratory disease at the moment in the emergency care system. If there's anything else that he would like to do, I will make sure that he is absolutely written to. Spirometry and pheno, along with the NICE guidelines, is something, as I said at the beginning of my point, is really something that is very long overdue, so I hope we do see some more progress on that. But if I have missed something, I'm very happy for my honourable friend to be written to, and he will respond very promptly. So can I thank Mr Rossendale, honourable members for Strangford and the APPG for raising this. I'm genuinely very pleased to see it raised up the issue. I think that is absolutely right. As a contributor to admissions and inequalities, it's a very serious disease and we do need to highlight it. So I want to thank him for the invitation to take part in discussion with healthcare professionals and the way ahead for respiratory health, and my ministerial colleagues look forward to discussing it further.
Jim Shannon to wind up.
First of all, can I thank everyone for their contribution? It has been incredibly helpful. It wouldn't be any secret that I always look for consensual debates because I think that they're more positive. I think we've had that today. I think we've had an opportunity to discuss many issues. Kind of, with your indulgence, Mr. Chairman, just speak to each one. The honourable member for Newcastle upon Lyne, as he has done since he came to this House.
Really the done thing to give way during a closing wind-up speech. On then, point of order.
My constituency is under Lyme, not upon Lyme. Several colleagues have said upon Lyme, and it's under.
I'm sure that will be on the record now. Thank you.
I'll never get it wrong again. Can I thank him for his contribution? Air quality was a massive issue. It's been a massive issue for the Honourable Gentleman since he came into this House. He has reiterated that over and over again. I'm hopeful that he will have the success that he hopes to have. He also referred to deprivation and low income as factors. The respiratory health priority is needed, and the Minister has confirmed that. The Honourable Gentleman for Ready to, in his intervention, referred to the regular asthma checkups. He's right to do that, and we need to have that. The Honourable Lady for Bladen and Consett. It's always a pleasure to work alongside the Honourable Lady. She and I have done this over the last 5-6 years, and it's a pleasure to have her contribution. First-hand evidence in our surgery each day, improve access to diagnostics and medical help. The Honourable Lady for Sherwood Forest. I thank her for her personal contribution. There's nothing tells the story better, Mr. Chairman, than a personal contribution. And we do, like the Minister said, hope that our family members are able to deal with the issues that they have in a positive fashion. I hope that hopefully the medical care will be there as well. Thank her for that. She also referred to the disease drastically changes lives. She referred to some not being able to walk. I think and made a focus upon charity work as well, which is really important. Thank her for that. The Honourable Gentleman for the Lib Dems, he referred to air pollution, as his party has done over all of the years, by the way, and underlined exactly the problems there. He also the impact upon children. He also referred to, Honourable Gentleman referred to the oldest housing stock. These are critical issues. Farmers' lung, which sometimes we forget about, but we, if you live in the countryside, you don't forget about it because it's a big issue. And again, he referred to the RSP and referred to the impact upon mothers who are pregnant as well. The importance of vaccination. The shadow spokesperson, the Honourable Member for Hickley and Bosworth, reminded that his first job was this issue, which gives him an incredible interest and input into this debate, and we thank him for everything he's put forward. The last government had a plan. I think that's to be fair to say that. A more holistic approach is needed, and he thanked for the APPG's role. Prevention is absolutely the way to go. Data is so important as well, and he also mentioned spirometry. And in fairness, the Minister responded in an excellent fashion. Can I thank the Minister for? I wrote down all the things that the Honourable Lady had said. First of all, for the meeting. Obviously, the Minister's watching and was able to respond, and we'll take him up on that. And we thank him for that as well. The Honourable Lady referred to our former job application, where she had dealings with COPD directly, agreeable to the the round table. Government committed to the smoke-free society, the importance of that, bill pending, impact upon those who have lung cancer, preventable, and for children. The Honourable Lady also referred to the dampened homes, and really incredibly important issue, and it's coming up all the time in the Chamber as we deal with it. Vaccinations also, energy efficiency, fuel poverty. The Honourable Lady, if I can say so in a very positive fashion, responded to all of the issues that we required to have answers on. The respiratory network across the nation, COPD, a major contributor to respiratory health issues, and government are committed to that. Respiratory health is a priority for government and the biologics. It's not often you can come to a debate, Mr. Chairman, where you can have all the input from everyone and then have a minister who answers the questions. Thank you very much.
The question is that this House has considered respiratory health. As many as are that opinion say aye. To the contrary, no. I think the ayes have it. The ayes have it. Order, order. The sitting stands adjourned. Almost perfectly.